What is asthma? Asthma is a chronic respiratory condition that affects the airways in the lungs, causing them to become inflamed, narrow, and produce extra mucus. This can lead to difficulty breathing, coughing, wheezing, and shortness of breath. Asthma varies in severity, from mild cases that cause occasional symptoms to severe cases that significantly impact daily life. Severity of asthma. Mild asthma defined by minimal symptoms and minimal risk of exacerbations in patients who are not using inhaled therapies, who are using reliever therapy alone, or who are using low-dose inhaled glucocorticoids along with reliever therapy. Moderate asthma defined by good asthma control with medium-dose inhaled glucocorticoids or low-medium dose inhaled glucocorticoids with additional controller therapies. Severe asthma defined by asthma requiring high-dose inhaled glucocorticoids with additional controller agents. To maintain good control or uncontrolled asthma despite these therapies. By these retrospective definitions, asthma severity can only be assessed after achieving good control and stepping down therapy to find the minimum effective controller therapy, or unless asthma remains uncontrolled despite maximized therapy. Causes and risk factors. Genetics. Asthma often runs in families, so genetics can play a role. Environmental triggers. Common triggers include allergens, like pollen, mold, pet dander and dust mites, air pollution, cigarette smoke, and chemicals. Respiratory infections, viral infections, particularly in childhood, can contribute to asthma development. Occupational factors. Exposure to certain chemicals, dust or fumes in the workplace can trigger asthma. Symptom control. Good asthma symptom control is generally defined by the following. Daytime asthma symptoms less than 2 days a week. Rare to no nocturnal awakenings due to asthma 1 per month. Use of SABA relievers less than 2 days a week. No interference with normal activities. Managing asthma with inhalers. Regular use of long-term control inhalers. These should be used daily as prescribed. Even when you're feeling well, to maintain control over asthma and prevent attacks, keeping a rescue inhaler handy. It's essential to carry a rescue inhaler at all times to manage sudden symptoms. Monitoring usage. If you find yourself using a rescue inhaler more than twice a week, it may indicate that asthma isn't well controlled, and you should consult a healthcare provider for a potential adjustment in medication. Using a peak flow meter. This device helps monitor asthma control. Low peak flow readings can indicate worsening asthma, even before symptoms appear. How to choose the correct medication and dose. The initial choice of medication is based upon age of the patient, e.g., is greater than or equal to 12 years, 5 to 11 years, 0 to 4 years, symptoms, lung function, risk factors for exacerbations, patient preference, and practical issues, e.g., ability to use the medication delivery device, accessibility of medication. For adults and adolescents, for children 4 to 11 years, for infants and toddlers. Inhaled bronchodilator reliever therapies. All patients with asthma should have immediate access to an inhaled bronchodilator, with a rapid onset of action for prompt relief of asthma. Symptoms. Short-acting beta agonist alone. The traditional choice has been a short-acting beta agonist SABA, e.g. albuterol or levobutyl. Beta agonist plus inhaled glucocorticoid. Alternative is the use of agents containing an inhaled glucocorticoid called anti-inflammatory reliever therapy AIR, which has been promoted by national and international guidelines based on trials that demonstrate decreased exacerbation rates relative to albuterol alone as a reliever across different levels of asthma severity. Additional treatments and strategies. Oral corticosteroids, sometimes used for short periods during severe asthma attacks. Allergy management. If allergies trigger asthma, immunotherapy, allergy shots might be recommended. Lifestyle changes, regular exercise, a balanced diet, avoiding triggers, and quitting smoking can improve asthma control. Inhalers are a critical part of managing asthma, and learning how to use them correctly can make a significant difference in your quality of life. Working with your healthcare provider to find the right inhaler and medication plan is essential to achieving effective asthma control. Types of inhalers. Asthma inhalers deliver medication directly to the lungs, making them highly effective with fewer side effects than oral medications. There are several types. Metered dose inhalers (MD) is description, the most common type of inhaler. They deliver a specific dose of medication in a mist or spray. Use typically requires coordination. Users need to press down on the inhaler while inhaling deeply. Spacer. A spacer can be attached to an MDI to make it easier to use, especially for children or people with difficulty coordinating their breathing. It allows the medication to be inhaled more gradually. Dry powder inhalers, deep description: these inhalers release medication in the form of a dry powder. Use: unlike MDs, they do not require pressing down on a canister. The user inhales the powder deeply and rapidly. Examples: discus, ellipta, and turbohaler are some common types of DP. Soft mist inhalers SM is description: a newer type that delivers a slow-moving mist, making it easier to inhale the medication deeply. Use: they require a twisting mechanism to prepare the dose, and then the user inhales the mist slowly and deeply. Description: nebulizers convert liquid medication into a fine mist that can be inhaled through a mouthpiece or mask. Use: commonly used for young children, elderly people, or those with severe asthma who struggle with inhalers. The treatment session usually lasts several minutes. Using an inhaler effectively. Preparation: shake the inhaler for MDS, exhale fully, and then bring the inhaler to your mouth. Inhalation: take a slow, deep breath in while pressing the inhaler. Hold your breath for about 10 seconds to allow the medication to set in Vauer lunas. Spacer use: if using a spacer, attach it to the inhaler, spray the medication into the spacer, and inhale through the spacer's mouthpiece. Cleaning: regularly clean the inhaler or spacer according to the manufacturer's instructions to ensure optimal performance.